consists of muscle that forms the pelvic floor and the pelvic wall, supporting the pelvic organs and assisting in the movements of the lower limb. The pelvic floor supports the pelvic organs, maintains the continence, and assists in the childbirth. It consists of levator ani muscle group, main pelvic floor muscle, pubococcygeus, puborectalis, iliococcygeus. Pubococcygeus forms the majority of the pelvic diaphragm. Puborectalis forms a U-shaped sling around the anorectal junction, maintains the fecal continence. Iliococcygeus provides a structural support to the pelvic organs. Coccygeus, ischio-coccygeus, posterior part of the pelvic diaphragm supports the coccyx and pulls it forward after the defecation. Perineal muscle supports the urogenital structure. Vulvospongius covers the bulb of the vestibule in females and compresses the bulb of the penis in males. Ischio-cavernous assists in the erection by compressing the venous damage. Superficial and deep transverse perineal muscles stabilize the perineal body. External urethral and the anal sphincter control the urine and fecal continence. Muscles of the pelvic walls. These muscles form the lateral and the posterior walls of the pelvis. Abductor internus covers the lateral pelvic wall, exists through the lesser sciatic foramen to insert on the femur. Function lateral rotation of the thigh. Piriformis covers the posterior pelvic wall, exists through the greater sciatic foramen. Function lateral rotation and abduction of the thigh. Innervation of the pelvic muscle. Levator ani and the coccygeus. Pudendal nerve S2 to S4. Abductor internus. Nerve to the abductor internus L5 to S2. Piriformis. Nerve to the piriformis S1 to S2. Perineal muscles on the sphincter. Pudendal nerve S2 to S4. Functions of the perineal pelvic muscles. Support the pelvic organs, bladder, uterus, and the rectum. Maintain the continence of puborectalis sphincters. Assist in the childbirth, levator ani structures during the delivery. Aid in the defecation and the urination. Contribute to the sexual function. Vulvospongius, ischio-cavernous. Facilitate the hip movement, abductor internus, and the piriformis. Pelvic organ prolapse. Weakness in the levator ani leads to the uterine bladder or the rectal prolapse. Fecal incontinence. Restriction of the puborectalis and the external anal sphincter. Urinary incontinence. Weak pelvic floor affects the urethral support. Pudendal nerve injury leads to the perineal pain, sexual dysfunction, and the incontinence. Piriform syndrome. Sciatic nerve compression causing the vertex pain. Pelvic flora. Levator ani. Pubococcygeus, puborectalis, and the iliococcygeus plus coccygeus. Levator ani. S2 to S4 pudendal nerve supports the pelvic organs and maintains the incontinence. Abductor internus and the piriform lateral rotate the thigh. Abductor internus exists through the lesser sciatic foramen. Piriform is through the greater sciatic foramen. Pelvic organ prolapse released from the weak levator ani muscles. Pudendal nerve S2 to S4 controls the perineal muscle and the external sphincter. Piriformis syndrome can cause sciatic nerve compression and pain.